This is the AM News. Let's start from stories in the health sector. Kidney Patients Association in the country fear the worst as treatment of kidney patients across the country encounters some challenges. The Komfo Teaching Hospital have had to turn some patients in need of dialysis treatment away, as it currently operates only one functional dialysis machine. Services are limited on only in-house patients. Nanaya Ojima has more in the following report.
Dialysis is a procedure to remove waste products and excess fluid from the blood when the kidney stops working properly. The failure of kidney patients to get the service when necessary may lead to death. The Komfo Teaching Hospital is a referral hospital for 12 of the 16 regions in the country. Its nephrology unit is challenged with the necessary tools for the procedure despite the relevance. Professor Oche Ademensa explains some critical decisions the hospital has taken.
The truth is that we at Komfo presently have, I usually say, 1.5 dialysis machines. And it's because one is working at full capacity, the other is working at fault. And so what it means is that we are no longer able to receive patients from outside for dialysis. So the dialysis in this hospital is restricted to 2 patients who are within the hospital. One of the most difficult calls I have had to make as a chief executive was when I was approached by my medical director, and who posed a question as to whether or not he was okay to send patients who needed dialysis to private facilities for dialysis. As difficult as our call was, it had to be made because we do not have sufficient dialysis machines. And Mr. Minister, the truth is that for each dialysis session, it takes 4 hours. And so what it means is that if you have 2 dialysis machines in-house and you have, say, 5 patients who need dialysis, what it means is that if God does not intervene, then by the time he gets to the turn of the 5th person, he probably would have popped off.
The tooling challenge of the hospital is not limited to dialysis machines. For over 18 years, the hospital has been without mammography machines.
One key example is a mammography machine, which for the past about 18 years we haven't had one. And so we are picking up breast cancer cases in stages 3 and stage 4. Apparently about 70% of the cases of breast cancer are diagnosed in stage 3 and stage 4, basically because the effective screening that ought to be done with the help of a mammogram machine is not being done.
Meanwhile, the challenge with spacing continues to affect the hospital's operations. Professor Dr. Ademensa explained though the hospital is constrained, they are forced to congest their facilities.
Indeed, if Komfo decides to close off the emergency center for 24 hours because it is full, and as we speak, the place is meant, orange ward is meant for 12, we presently have about 42 patients. Yellow is meant for 18, we have about 27 patients. Red is meant for 7, we have about 10 patients there as we speak now. And so if we decided that we're no longer receiving emergencies, obviously because the place is full, what it means is that we are practically asking patients who come in who are turned away to go and die.
The release of funds for works on the mother and baby unit comes as a relief for many in the Ashanti region. Finance Minister Dr. Mohammed Amin Adams reveals 14 million euros have been released for the purpose.
Can I show you, because of the concern by our president, the directive for us to find money and address these outstanding infrastructure issues. You have seen us moving very quickly. And this visit by me demonstrates that commitment to addressing these challenges so we can bring relief to the people of Kumasi, Ashanti region. And I know that a lot of cases are referred to Komfo from other regions of the country.
For JoyNews, Nanaya Ojima, Kumasi.
Unhealthy lifestyles and lack of exercise identified by the Ghana Society of Cardiology as 2 major causes of stroke continues to be mostly reported by younger persons at health facilities across the country. Concerned about this development, the society is intensifying its education on the need to be mindful about the foods consumed and with an advocacy for regular checkups. Vice President of the society, Dr. Francis Ejekum, who made this known at its annual General Scientific Meeting in Accra yesterday. Here's what he said.
Formerly, we used to say that atherosclerotic cardiovascular disease is the disease of the rich countries and things, but now we are seeing a number of them. You can attest to the fact that you are hearing a lot of stroke cases on the wards. There was one time I was in a district hospital, large general hospital, a bed capacity of about 10 beds on the ward. Sometimes about 6 to 8 of them are occupied by stroke patients. These days, we are seeing a lot of heart attack. We get calls every now and then, people having heart attack. We need to go and try to open the artery for them. There are a lot of patients with other problems like impotence, kidney disease. All of these are part of the problem. So it is a common problem. There was a study that was done in Kumasi to look at the atherosclerotic cardiovascular disease on the wards, and over a period of 10 years there had been more than 250% increase in the cases that were being admitted there. So that is a very common condition and it's increasing as well.
He also called for a regular checkup and change in lifestyle to avoid cardiac-related diseases.
Major thing is that the risk factors are also increasing. Our lifestyles are changing. These diseases are as a result of lifestyle behaviors, many of them. I mean, of course, there are few people who have genetic conditions, but many of them are as a result of lifestyle changes. The way we eat, the kind of food we eat. I mean, people are now eating more energy-dense meals, fast foods, cholesterol, excessive salt intake. People are eating less of fruits and vegetables. People are not exercising. We go and sit in our rooms. In fact, there are people who wake up from their bed, sit in their cars to go to work, and then come back, sit behind the television and sleep. There's no exercise at all. And then even less sleep. Sleep deprivation has also been noted to be one of the risk factors. So as a society, our main interest is to be able to advocate and make people aware of these things so that we can help prevent. So we are going to educate more people in terms of prevention.
General Secretary of the Society, Dr. Lambert Appiah, called on government to make the training of cardiopulmonary resuscitation by national service personnel mandatory. He also urged companies to train some of their workers on how to administer CPR, which can easily save some lives.
I'd like to also make the humble appeal to various institutions, corporate and individual institutions to at least make sure that there is provision for these automated defibrillators in their offices. Make sure at least they, select or individuals within these various institutions to have some basic training so that they can roll over to the other membership of that organization. The idea is that if everybody in any institution or all institution, at least, even if it's one person, will have an idea what to do when somebody collapses from a cardiac arrest, it will be very useful, it will be life-saving. Even if a young person, like we hear these days, young person, we collapsed, if somebody knows how to do CPR, who knows, it may be life-saving. So local, international organization, once you're running a business, you have some kind of, staff. The staff should know how to do CPR. So this is a humble appeal we can make to, societies and then to government to also look at that space of training service personnel in CPR.
Dr. Lambert Appiah is the General Secretary of Ghana Society of Cardiology in the country. Residents in Peve in the Afajato South District of the Volta region are expected to receive improved healthcare services following the remodeling of the Community Health Center by the Korean Foundation for International Health. The remodeled facility is equipped with the requisite logistics to provide primary health care, including improved maternal services to eradicate maternal mortality and complications. There's more in the following report.
The Peve Health Center previously operated in this structure, which had limited space, impeding quality healthcare delivery. Nonetheless, with funding from the Korean Foundation for International Health, a well-equipped facility has been constructed. It is furnished to meet the basic health needs of residents. The Volta Regional Health Director, Dr. Crisantus Kubio, enumerated the objective of the facility, which falls under the Maternal, Newborn and Child Health Care Project being implemented by Kofi.
The focus of the project is to improve maternal, newborn, and child health care through quality improvement of health care delivery and health systems strengthening, focusing on emergency delivery and referral systems in 2 districts of the Volta region, namely Afajatu South and Koboy.
The country director of Kofi, Bomin Yang, said his outfit would continue to commit resources to expanding infrastructure in the health sector.
As we move forward, Kofi reiterates its commitment to continuously support Ghana's healthcare sector. We are profoundly grateful for the cooperation and partnership with the Ministry of Health and Ghana Health Service. Today's inauguration symbolizes more than the opening of our facility. It signifies progress in our journey towards a healthier Ghana. Together, we have laid a foundation for a future where quality healthcare is accessible to all.
The outgoing Deputy Minister of Health, Mahama Asay Seini, said the government has launched the network of practice to enhance healthcare delivery at the local level.
The health sector has begun implementing an intervention called the network of practice, which seeks to leverage resources at the primary healthcare level to improve health services delivery. The network of practice initiatives will lead to improvement on the condition of health facilities, enhance staff capacity, community participation, and collaboration between the health facilities.
The Afajatu South District Chief Executive, James Etonam Fululu, entreated Ghanaians to cultivate the culture of routine health checkups. Private traditional authorities appreciated provision of the facility by Kofi and appealed for the construction of a nurses' quarters. Fred Kwame Asari, Joy News, Peve Old Town.
Away from that, Speaker of Parliament Alban Bagbin has urged the youth to engage in politics to address their concerns without being partisan in their deliberations. Speaking at the inauguration of the Sunyani Adolescents Parliament, the Speaker lent his support to the initiative. He said it's a platform to empower youth to debate issues affecting them and engage city authorities to speed up development in the communities. Precious Temevo has more.
According to the Resilient City for Adolescents project by the Global Media Foundation, GLOMETH, and Botna Foundation, the essence of Sunyani Adolescent Parliament is to build the capacity of the youth to enable them to exercise their right to engage city authorities on their concerns. Speaking at the inauguration in a parliamentary setting in Sunyani, the Chief Executive of GLOMETH, Raphael Godlava-Henu, said the initiative would be sustained to help address the developmental concerns of the youth.
What we are doing under the Resilient City for Adolescents project is to build their capacity in terms of advocacy, build their capacity in terms of generating evidence, and also build their confidence level so that they will use that opportunity to engage with the stakeholder within the Sunyani city. We have established what we call intermediary city ecosystem platform. It's a platform of all key stakeholders within the Sunyani city. When the adolescents identify those kind of issues, then they will be able to identify a stakeholder who will be able to address those issues. And I know by the support of all key stakeholders, Adolescent Parliament will be sustained and provide a lasting solution to issues affecting adolescents within the Sunyani municipality.
Sunyani has been zoned into 19 constituencies with elected members of parliament and a speaker, Daniel Frimpong Sarkodie. He expressed worry about the Bono Regional Library being abandoned for over 20 years.
Last time when we visited the Sunyani Regional Library, the place was full with bed bugs, cobwebs, and all sorts of things. My appeal to the authorities is that they should produce electronic devices and suitable chairs and background for the children.
Speaking on behalf of the Speaker of Parliament, Alban Bagbin, MP for Banda and Deputy Minority Chief Whip, Ahmed Ibrahim, urged the youth MPs to avoid partisan politics in their deliberations for solutions to their developmental concerns.
The youth or adolescents have exposed the weaknesses of this current generation of leaders. I think nobody who saw that video of the library, whether NDC MP or MPP MCE, was happy. But this is the voice we are giving to you, the youth. Speak out. Point out our weaknesses. Don't say, oh, it is not politics. Do politics. Politics is not a bad thing. Politics bring out democratic dividends. That is development. However, partisanship is what is evil. And that is what is killing us. When you spoke, I was humbled. Nungwa Library is finished. Eagles Library is finished. The other libraries are finished. Sunyani Library is there, 21 years. And this is a platform where you can come together. We, the politicians in Bono, must also come together. It is not the duty of only MPP or NDC. We must also have a common platform like this.
Precious Semevo, JoyNews, Sunyani.
Now, 282 persons with disabilities, including 90 former toll booth operators, have been recruited by the Youth Employment Agency in a bid to curb the high unemployment rate in the community. At a briefing in Accra, Chief Executive Officer of the YEA, Kofi Ejapong, urged other state and private agencies to create employment avenues for persons with disabilities.
Government cancelled road toll collections in 2021 after introducing the e-levy. The decision affected a number of persons with disabilities who constituted a majority of the toll collection workforce. Now the Youth Employment Agency has set up regional and district disability desks, leading to the recruitment of some persons with disability as officers. Chief Executive Officer of the YEA, Kofi Ejapong, explains the initiative.
It brings me immense joy to announce to the people of Ghana, through your esteemed media or platforms, that the Youth Employment Agency has successfully recruited 282 persons with disabilities possessing at least a senior high school qualification. And I repeat, it brings me joy, immense joy, to announce to the people of Ghana through your esteemed platforms that the Youth Employment Agency has successfully recruited 282 persons with disabilities possessing at least a senior high school qualification. These individuals have been appointed as staff members of our agency. These individuals have been appointed as staff members of our agency, with those holding diploma or higher qualifications assuming roles as regional disability desk officers, and those with senior high school qualifications appointed as district disability desk officers across all 16 regions and 266 operational districts, respectively.
President of Center for Employment for Persons with Disabilities, Alexander Kojo Tete, said his outfit is able to employ only 20% of those who apply for jobs. He's therefore calling on other sectors to employ persons with disabilities.
The center was established in 2008. Okay, I can say that on average we have received over 3,000 applications, not applications, CVs of graduates who want employment. We have been able to assist only 20%. because it is not an easy job. Most employers would not want to employ disabled people. Secondly, our environments are not accessible. It becomes a huge problem.
A percentage of the District Assembly Common Fund is set aside to address the concerns of persons with disability. Chairperson of former toll booth workers, Rashad Mohammed Ramat, says accessing that money has been challenging.
We are going to deal about issues of persons with disability in our district, the inclusiveness, so that they will be part of the district. There are issues of persons with disability in our district that are, example like our common fund, the way they are treating us at the district is very, very bad. When it comes hardly for persons with disability to get it. So that is going to be more of our focus.
The Youth Employment Agency says it is working on ways to employ the rest of the former toll booth workers.
In a heartening display of corporate social responsibility, the Association of Sports Betting Operators has stepped forward to support education in flood-affected areas. Amidst the challenges posed by recent disasters, the association has taken proactive measures to aid the education sector by presenting learning materials to 939 pupils in communities ravaged by floods. Ivy Setoji has more in the following reports.
The devastating impact of floods often extends beyond immediate physical damage, disrupting essential services such as education. Recognizing the importance of ensuring continuity in learning, particularly in vulnerable regions, the Association of Sports Betting Operators mobilized its resources to provide vital support to affected schools. The initiative aimed at easing the burden on communities grappling with the aftermath of floods saw the distribution of educational materials ranging from textbooks to stationery supply in Anyako in the Keta municipality, and these provisions are intended to assist children and educators in overcoming obstacles posed by the disruption of academic activities due to the disaster. Speaking on behalf of the Association of Sports Betting Operators in Anyako, the president of the group, Dr. Kobe Boatin, emphasized the organization's commitment to supporting communities in times of crisis.
We heard of your plight and what had happened some few months ago. And because of that, I spoke with my treasurer as to the needs of the various communities around. And from your community, we got to be aware that you might need stationery and books for the schools that are around this area. So we took my delight in that and then procured all these stationaries, and today we came down here to commission them, and also to say that if in future you need any other further assistance, you'll feel glad to ask, and we shall be glad to be here in time to make sure that you have them. Thank you very, very much.
The distribution of learning materials to 939 pupils marks a significant milestone in the association's ongoing efforts to promote social welfare and community development. The gesture has been warmly received by local authorities, community leaders, and school children who have expressed gratitude towards the Association of Sports Betting Operators for its timely intervention. Togbi Dukui Atipo received the items on behalf of the community.
We appreciate your good gesture. Nature, and for that matter God, has given talent to each and every one. However, he goes to sharpen this talent, giving talent in the formal educational sector. Materials and other relevant tools are very necessary to be used to achieve that purpose. It gives enabling environment for effective teaching and learning. It is in light of that that we, the chiefs and the people of Anyakokong, appreciate your gesture and thank you very hippopotamously.
As the affected communities strive towards recovery and rebuilding, initiatives like these serve as beacons of hope, reaffirming the resilience and solidarity of communities in the face of adversity. Ivy Satoji, JoyNews, Anya.
That will be all for the news bulletin. Up next is a news review with Benjamin and I. The conversation starts now. You can join on social media from JoyNews on TV. Stay with us.